Did you know that over 450 million people worldwide are living with diabetes? That's nearly 1 in 10 adults. Diabetes is one of the most common chronic conditions in the world, yet many people don't fully understand what it is or how it affects the body. But here's the thing, it's not just about blood sugar. It's about how your body processes glucose and how that can affect your heart, kidneys, and even your eyes. In today's video, we're diving into the basics of diabetes, what it is, the key differences between type 1 and type 2, and how it impacts millions of lives around the globe. Let's get started. What is diabetes? First, let's understand what diabetes really is. Diabetes is a condition that affects your blood sugar, glucose, levels. Normally, your body converts food into glucose, which is then used for energy. The pancreas, a small organ behind your stomach, produces a hormone called insulin. Insulin helps move glucose from your bloodstream into your cells, where it's used as energy. In diabetes, your body either doesn't produce enough insulin or doesn't use insulin properly. When glucose can't enter your cells, it stays in your bloodstream, causing high blood sugar levels. Over time, high blood sugar can lead to serious health problems, like heart disease, kidney damage, and nerve issues. Diabetes comes in two main forms: type 1 diabetes and type 2 diabetes. Let's break them down. Type 1 diabetes. Let's start with type 1 diabetes. This is a type of autoimmune disease where the body's immune system mistakenly attacks the cells in the pancreas that produce insulin. As a result, people with type 1 diabetes have very little or no insulin production. They must take insulin every day to manage their blood sugar levels. Type 1 is usually diagnosed in children or young adults, but it can develop at any age. While we don't know exactly what causes type 1, it's believed that a combination of genetic factors and environmental triggers, like viral infections, plays a role in its development. People with type 1 diabetes can lead a healthy life with proper insulin management and lifestyle choices. However, without treatment, high blood sugar can quickly lead to complications, so insulin is critical for survival. Type 2 diabetes. Now, let's talk about type 2 diabetes, which is the more common form, accounting for 90% to 95% of diabetes cases worldwide. In type 2 diabetes, the body becomes insulin resistant, meaning the cells don't respond properly to insulin. As a result, glucose builds up in the bloodstream, even though the pancreas is still producing insulin, just not enough to keep up with the body's needs. Type 2 diabetes typically develops over time and is influenced by lifestyle factors like obesity, sedentary behavior, and a poor diet. People with type 2 diabetes often have a family history of diabetes and can develop the condition as they age. Unlike type 1, type 2 diabetes is often preventable and can be managed with lifestyle changes such as a healthy diet, regular exercise, and weight loss. However, if untreated, type 2 diabetes can lead to severe complications, including heart disease, kidney disease, and nerve damage. So, how big is the diabetes problem? According to the World Health Organization, WHO, over 450 million people around the globe are living with diabetes. In the United States, about 34 million people are affected, and nearly 90% of them have type 2 diabetes. Type 1 diabetes affects roughly 5 to 10% of people with diabetes, while type 2 diabetes is by far the most common, especially as obesity rates rise worldwide. And here's the concerning part. Diabetes-related complications like heart disease and kidney damage contribute to millions of deaths annually. In fact, people with diabetes are 2 to 3 times more likely to suffer a heart attack or stroke than those without the condition. How diabetes affects the body. Left unmanaged, high blood sugar from diabetes can cause serious damage to several parts of the body. Heart disease. Diabetes increases the risk of heart disease by damaging blood vessels and increasing cholesterol and blood pressure levels. Kidney disease. Over time, high blood sugar damages the tiny blood vessels in your kidneys, leading to kidney disease and possibly kidney failure. Nerve damage. High blood sugar can damage nerves in the hands, feet, and organs, leading to conditions like diabetic neuropathy. Vision loss. Diabetes can damage the small blood vessels in your eyes, leading to diabetic retinopathy, which can cause vision problems and even blindness. How diabetes is diagnosed. Now, you might be wondering, how do I know if I have diabetes? Well, diabetes can be diagnosed through simple blood tests. The most common test is the A1C test, which measures your average blood sugar level over the past 2 to 3 months. An A1C level of 5.7% to 6.4% indicates prediabetes, while a level of 6.5% or higher on 2 separate occasions typically indicates diabetes. Your doctor may also perform a fasting blood sugar test or an oral glucose tolerance test to check your blood sugar levels after fasting or consuming glucose. How to prevent type 2 diabetes? Here's the good news. Type 2 diabetes is preventable. If you're at risk, there are steps you can take to lower your chances of developing it. Maintain a healthy weight. Even losing 5 to 10% of your body weight can reduce your risk. Exercise regularly. Aim for at least 30 minutes of moderate activity most days of the week. Exercise helps the body use insulin more efficiently. Eat a balanced diet. Focus on whole grains, vegetables, lean proteins, and limit processed foods and sugars. Stay active. Move more and avoid sitting for long periods. Even small activities like walking or using stairs can help. Making these changes today can help you stay healthy and reduce your risk of diabetes tomorrow. To sum it up, diabetes is a serious condition that affects millions of people worldwide. Whether you're at risk for type 1 or type 2 diabetes, the key to managing it is early detection and making healthier lifestyle choices. If you're concerned about your risk for diabetes or if you're already living with the condition, take action now to control your blood sugar and prevent complications. If you found this video helpful, give it a thumbs up, share it with someone who might benefit from this information, and don't forget to subscribe for more health tips and advice. Take care of your health, and we'll see you in the next video. Watch our next video to learn about the symptoms of type 2 diabetes and how you can start preventing it today.